President Uhuru Kenyatta is meeting county governors to review measures put in place across the country to contain the spread of the coronavirus pandemic. The fifth extraordinary session of the National and County Governments Coordinating Summit will also assess the impact of the phased easing of restrictions earlier put in place, including the lifting of cessation of movement order in parts of the country. The meeting comes amidst a surge in the positive cases of coronavirus, with the highest numbers recorded on Sunday after 960 people tested positive for the virus. Anxiety gripped the nation when the first case of coronavirus was reported in March, and as the positive cases continued to rise, the government put in place strict containment measures, which included a dusk to dawn curfew, as well as imposing a cessation of movement order in hotspot counties, a directive that affected not just the way of life, but brought the economy almost to its knees. The president would then face the dilemma of choosing to restore the collapsing economy and monitoring the surge in positive cases. And on July 6th, in his presidential guidelines on COVID-19 pandemic, the head of state would allow a phased reopening of the economy.
With this expert opinion at hand, and the counsel offered by the National Security Council, I therefore today announce a phased reopening of the country as follows. 1. Today I order and direct that the cessation of movement into and out of the Nairobi metropolitan area, Mombasa County, and Mandera County that is currently in force shall lapse today or at 4 a.m. tomorrow, Tuesday the 7th of July, 2020.
A decision that was lauded by the drivers of the economy, but dreaded by public health officials who feared that the health system may be overwhelmed with a further spread of the virus. Of significance in the presidential directive, however, was how the burden of responsibility was thrown back to Kenyans, adding that he will be forced to return to the lockdown if the patterns of interactions and the spread of the disease show that the condition is worsening.
Serikali itachukua jukumu lake. Hiyo hatutasita kufanya. Lakini kama tutafaulu, kama nchi, tutafaulu kwa sababu kila mmoja wetu, mdogo ama mkubwa, mtoto hata mzee, mama ama baba, tutafaulu tukiwa kila mmoja wetu atachukua jukumu lake kibinafsi.
The president issued a statement at a time the country had recorded 8,067 positive cases of COVID-19. Since then, the numbers have risen past the 17,000 mark, meaning that over 9,500 cases have been confirmed within 21 days, making July the worst month since Kenya recorded its first case of COVID-19. So does this situation warrant tougher restrictions to be put in place to contain the spread of COVID-19? That remains the elephant in the room as the head of state hosts the fifth extraordinary session of the National and County Governments Coordinating Summit Monday that will review the virus containment measures and the impact of the phased easing of restrictions earlier put in place. Opinion remains divided over whether the country should close down or Kenyans adapt to the new normal.
President akiweka lockdown kwa Kenya, kuna watu pia hata uliwa na ugonjwa wa COVID, watakufa na njaa. So kama ataweka lockdown, kwa maoni yangu, sasa ni lazima serikali ya county ifuatilie wale watu hawatakuwa na chakula.
Tangu tufungiwe nchi mwezi wa 3, hakuna mtu, ukiongea na watu ukweli, hakuna mtu amepata hiyo pesa serikali ilikuwa inasema inapeana. So kwangu mimi binafsi naweza sema watu wajue venye wataishi na hii ugonjwa. Hii ugonjwa WHO already imesema bado haijapata dawa.
Naweza sema kufungwe because the cases zimeongezeka rather than venye kulikuwa kumefungwa. Venye kulifunguliwa watu wengi wamekuwa like sick na cases zimeongezeka mob.
If we allow people who have been infected to mingle with others, people going up country, meeting everywhere, it will be really serious. And the best thing is we could still control at this particular moment when we are still below 20,000.
Nairobi has recorded hundreds of cases since the July 6th presidential directive that lifted the cessation of movement order, remaining at the top among the counties which have recorded the highest positive cases of COVID-19. Other counties recording cases include Kajiado, Kiambu, Machakos, Mombasa, Busia, Garissa, among others.